My name's Ashi Giles. I live in Boulder, Colorado. I attend the University of Colorado. I'm a runner. I'm an economics and finance major, and I'm 21 years old. I was having a problem with my tooth that got knocked out playing football, and so we had to have an implant put in at some point. And Dinsmore had a plan, and he figured it out, and then he put the implant in, and that's the end of that. I'm also not a huge fan of change, especially when I was in the process of this when this whole teeth thing was going on. So of course I was a little skeptical at first, but first day meeting we talked and like, okay, I like this guy, he's cool, and my whole family really liked him. So, and it was kind of, and my mom had gone to him prior to me going to him, and she had told me he's a really great guy. Then my brother went, they told me he was great, and then I went into it with a little more ease, and then I personally met him, and I was like, oh, this is a great guy, we can definitely work with him. So the way he carries himself and the way he does his job is very professional, and we can definitely appreciate that. But at the same time, it's kind of like talking to somebody you've known for a good amount of time, which is nice. It's like if my next door neighbor, who's a good family friend of ours, was my dentist. Of course he's going to be professional about his job, but at the same time, you can have a conversation with him, and it seems like he genuinely does care about what's going on in your life, and we care about what's going on in his. So it was, I mean, once we switched to Dinsmore, we sat down and kind of figured out what needed to be done. He explained to us what our options were and what he thought was the best. So, we took his opinion on it. Then he sent us to a really good surgeon, Dr. Wetmore. He was also fantastic. He got the spacing just right. And then we just kind of started planning on what steps to take next. And basically every step just went really smoothly. We then talked. We figured out exactly what color tooth. And it was great because when we were doing the implant, the day of the surgery, we had to choose the color, everything right. We put it in, and we're done. We put the mirror in front of me, and I thought it looked great. And then he just wanted to keep working on it a little more. He kept changing things, and it just kept looking better and better. So it was definitely nice. You can definitely respect a professional that's going to take a little extra time to fix it. Even when I was kind of ready to get out. I was like, oh great, this teeth is in ready to go. But he just kind of took his time to really perfect it. And I think there's a certain amount of art to this, and I'm very confident in what he's done so far. Even just everything from cleaning to the surgery, everything I feel like was done very well. And you can really I really can't think of a better scenario where it could have gone, where it could possibly improve. It was great. The tooth seems really sturdy. I've had it for maybe almost a year now, close, 10 months or so. Absolutely no problem. So.